Hello, my name is Dr. Jose Luis Ruiz, and I'm the director of the Los Angeles Institute of Aesthetic Dentistry and Ruiz Dental Seminars. It is really a pleasure to share with you this very valuable information in regards to adjusting a single tooth for proper occlusal balance. This is a very important subject because, as we are all aware, occlusion is the number one reason why our restorations fail. It is also the most common reason why our patients would have post-op sensitivity. Of course, if our patients didn't chew and didn't put their teeth together, our restorations will never break. So occlusion is definitely a very important thing. And as we can see on these photographs, occlusion is really a very serious enemy of our patient's dentition. Some experts believe that occlusal disease is the number one reason why people lose their teeth. And as you can see again in the photographs, the patient to the right is destroying his teeth with his imbalanced occlusion. So we must diagnose it and we must treat our patients if we want them to be healthy. And the good news is treating patients with occlusal disease and giving our patients healthy occlusions is not that difficult. There are three golden rules of occlusions that we need to fulfill in order to give our patients this. First of all, equal contacts throughout, and this is logical. Second, posterior disclusion. In other words, whenever the mandible moves to the sides or forward, the front teeth will protect and separate the back teeth. That's called anterior guidance and canine rise. And finally, an unobstructed envelope of function. With those principles in mind, we can start the adjustment. I like to use two papers, blue for centric stop, red for lateral movements. I like to use a very thin 40 micron articulating paper, and the teeth have to be dry. The instructions are important. We don't want to tell the patient to close or chew. We want to give our patients clear instructions. Please tap your teeth together twice. That way we will get the centric stops when they tap their teeth together. So I will ask them tap tap, and sometimes I will ask them tap tap hard if I want to get crisper marks. Be careful not to say squeeze hard, because if they squeeze, then they will activate their masseters and they can actually break a restoration if it's high. Then we would like to use also CR, and in order to do that, we need to use by manual manipulation and learn that technique. I believe that technique is very desirable and using this would be good. Once we have these marks, then we can start adjusting. We want to remember that the contact should only be in the tip of the working cusp and on the central grooves. So any marks that are on slopes or any really big marks, we want to adjust them so there will be smaller marks on the appropriate place. Once we have these marks, then we are ready for the next step. We don't want to forget the next step because we know that people don't chew like alligators. They don't just chop chop. Their mandibles grind to the side in the direction of the food. Everybody does that. And we must mark those lateral movements and lateral interferences. And as you can see in this video, we use the red paper. And the instructions for the patient is to chew or grind their teeth together. And I like to tell them to exaggerate the chewing and go as far as can they go to the sides and as far as they go forward. So that way I get really good marks, and any red that is outside of blue, that is outside of the blue centric mark, has to be removed and adjusted. Otherwise, we will have interferences, and that will cause future fractures or restorations or post-op sensitivity. Now, at this point, we're almost finished. But there's one more thing that we want to do to be thorough, and that is to sit the patient up and then check again very quickly using both red and blue paper to see if with the postural change there will be a different mark. And sometimes we see a slight different mark, and then we will adjust it and then polish. Finally, I would like to encourage you to remember that our patients are suffering tremendously because of occlusal disease. And we should make an effort to always diagnose if our patient has occlusal disease. This is desirable for multiple reasons. Certainly, if we diagnose occlusal disease, we'll be able to help our patients and not see their teeth get destroyed over time. Also, we will be able to know which patients are at risk. When we treat them, we do restorations, we'll know that they are dangerous, that they are going to destroy everything that we put in their mouth. So we want to be more cautious in those situations. So diagnosing occlusal disease is very, very important. But it also has to be very practical. And for that reason, I've developed the Occlusal Disease Diagnosis System and Management System. And this allows us to diagnose and then implement occlusion into our practice in a very methodic and simple manner. First of all, stage 1 means that we need to diagnose if our patient has occlusal disease, and we do that by assessing if the patient has any of the 7 signs and symptoms of occlusal disease. This is quite simple. It takes about 3-4 minutes. We look at the patient's mouth, we ask them a couple of questions, and we will assess if this patient is at risk, if this patient is suffering from occlusal disease, and then we can educate them and then go into the different stages for treatment. And finally, I would like to extend an invitation to you to visit our website, ruizdentalseminars.com, and there is a section of a community forum. So if you have any questions or comments about this video, please go there, post your question. I'll be happy to answer your question. Also, we have a lot of information about other courses available on occlusion or supragingival dentistry, lectures and workshops. We look forward to seeing you again.